All right. Good afternoon, everyone. We are really excited for the third in our Faithful Families webinar series, which is strategies for shared use with physical activity, promoting physical activity. And we're excited to have you all here to talk with some folks who have been implementing shared use and other strategies to promote physical activity in the faith community setting. I am Annie Hardison-Moody, the Director of Faithful Families, and we'll be hearing from several different speakers today, and I'll let our speakers introduce themselves. But before we get started, I want to make sure that everyone has configured their audio, so you can use the microphone at the top left of your screen, which will configure your audio in case you want to speak during the webinar. But can I just get some folks to maybe raise your hands to make sure that everyone can hear okay? Okay, great. Thank you all. So before we get started with our webinar, I did want to let you all know that we're really excited to have a new Faithful Families Program Specialist, Kamaria Mason, and she is housed at the North Carolina Division of Public Health, and her contact information is listed on the screen. And so for those of you who are working on Faithful Families in North Carolina, Kamaria is your new contact. She has a lot of experience doing this work. Her background is in public health nutrition, and she is passionate about reducing health disparities among child and minority populations through faith-based interventions. In addition to serving as the Faithful Families Program Specialist, Kamaria is a registered dietitian and a nutrition blogger working on several projects that promote healthy eating and increase physical activity in her community. We are really, really lucky and really happy to have Kamaria on board, and I know that you all will just love working with her. So now you can see her face, and I hope that you'll get to know her at the Faithful Families Summit coming up in September. But she's a great resource for you and your kind of first stop if you have questions about Faithful Families or need any support for the program. So welcome, Kamaria. We're really, really excited to have you. And so at this point, I'm going to turn it over to Anna Stein, who's going to talk about shared use in the faith-based organization context. And Anna's also from the Division of Public Health. She's actually a legal specialist there. So Anna, I'll turn it over to you.
Thank you, Annie. So, all right, so I'm gonna go right into this, and I will start off talking about what is shared use. So I just want to say that if you look up shared use in the dictionary, you're not going to find it, and really professionals in the field, I think, have been winging it the last few years and kind of making up a new vocabulary, and it's almost like we just agree to call things a certain term, and at this point in time, it is shared use is what we have agreed on, but it'll probably change in a few years. So I just want to let you know that none of this is set in stone, and a lot of this is us making up terms and just agreeing to call things a certain thing. So shared use is a broad term that describes a situation where an institution, an organization, and lots of times you're talking about schools doing this, and also it could be faith-based organizations like we're talking about today. It's when they allow people outside of that institution or organization, so for example, non-congregants, to use the property, and typically you're talking about for recreation. That's where the shared use term is often used. And so what does shared use look like in the faith-based organization context? And you have probably seen this happening at your own faith-based organization. So this is, for example, when a church might rent facilities to a group to hold a yoga class in their multi-purpose room, or a faith-based organization might have classes on cooking or exercise, and they might invite the community to attend. Or it could be that there's just a playground or a basketball court on the grounds, and people from the neighborhood wander over there and use the playground, during the week, and the church, knows that's happening and kind of lets that happen. These are all shared use. So this is a really common I'd say it's very common for churches to engage in shared use, but the fact of calling it shared use and really examining it as shared use and trying to promote it might be a new thought for us. So let's see, there we go. Why is shared use important? And I'm probably preaching to the choir here. You all know that shared use can be a means to increase physical activity because it increases access to places to be active. Another thing that I've thought about and like about shared use is that I think it can be a means to increase social capital of the communities that it's in. And I haven't seen this talked about in the literature, but when you think about what people do when they engage in shared use, so they're inviting people onto their property to engage in programs or use the property. The people at the faith-based organization are perhaps thinking about what the community around them might need and trying to meet their needs. So you're really bringing people together and making people in the faith-based organization think about the needs of the outside community in a way that they maybe haven't been doing already, and that really can increase the social capital of the neighborhood, of the town, and that could possibly lead to improved health outcomes, even aside from the physical activity aspect of this. So I think there are so many multiple good aspects of shared use in the faith-based organization context. And it's also important to note that shared use can be a part of the faith-based organization's mission. Sometimes faith-based organizations might have a facility and welcome people outside the congregation to use it because they're thinking that it might attract new members, or a faith-based organization could, aside from even thoughts of increasing their membership, just think that it's part of their mission to care about the community that lives around their building and the health of that community and want to improve it and do what they can. So there are multiple ways that it can fit into the mission of a faith-based organization to allow non-congregants to use their facilities for physical activity. And another thing I wanted to point out is that in North Carolina, although we're only the 10th highest state in terms of population, we have the third highest number of faith-based organizations in the country. So, these are interventions that are really ripe for use in North Carolina to increase physical activity. So, types of shared use and terminology, and again, I just want to reiterate that we've kind of made up these terms as we've gone along. You're not going to find these in the dictionary. These might evolve, but these are the terms that we're using right now for these types of shared use. So, open use is a form of shared use when an institution allows the general public to just come on the property kind of spontaneously. Typically, you're going to see this for their outdoor property, lots of times for playgrounds or fields around the faith-based organization. And so they would let them come on without charge. And so we've called that open use. There's no contract for that use. And typically this is done without a formal policy in place. It's just something that's done in practice. But a faith-based organization could also create a policy. They could create an open use policy that spells out that they are intending to allow the neighborhood, the public, to use their playground during the week or whenever it's not in use by the faith-based organization. So this could be a formal policy. And I have not seen research that would indicate that one is better than the other. I know that in public health we tend to emphasize formalizing policies, and hopefully there will be some research at some point that looks at the outcomes and formalizing it or having a, kind of an informal in practice situation. But that's certainly an intervention that can be worked on, is to work with faith-based organizations to formalize their open use policy and get something in writing about that. The second type of shared use that you are going to see is when there is an actual contract in place between the faith-based organization and an individual or a group to use the space of that faith-based organization. And so many faith-based organizations are going to have a facility use policy where they lay out, this is what we're going to charge you to adopt our congregation room, our fellowship hall, our gymnasium, and so it's a kind of a rental agreement. So these are the types of shared use, and many times you're going to see both happening at the same faith-based organization. It's a mix. It's not either or. And here is just a pictorial representation of what I've just talked about. The shared use framework. Shared use is the umbrella term for all the different types of ways that the outside public could be invited onto the property of the faith-based organization. You're going to have open use when there's not a contract governing it, and you'll have joint use agreements or rental agreements when there is a contract that governs the use of the property. And then with open use, again, you could have a formal policy that governs that open use, or it could just be happening in practice without anything written down. So I want to point you to this on the right side of the screen. You see this document called Congregation to Community, Shared Use by North Carolina Faith-Based Organizations. And this is a wonderful document that was created by Change Labs 2 years ago, Change Lab Solutions. And we had a grant from the CDC, and they helped develop this for us. And it really is wonderful, and it really is going to go through all of the things that I'm talking about to you today. So you can go read through that. And one of the things that they have in that document is a checklist that on getting started. And so I pulled out a few of the things that they had identified. So one would be just to look at the existing congregational policies. What's in place? Is there a facility use policy? It's very unlikely there's an open use policy. So just see what's already in place. And then if you could find a point person to look at shared use at that congregation or a committee, consider what facilities inside or outside would be appropriate to share. Is there a place that you could hold exercise classes? Would that be economically feasible for you to bring someone in, or do you have a congregant who can offer them? So what's going on at this faith-based organization that they can capitalize on and really build out the physical activity at that property? And then, so it's important to include community members to determine what would be helpful to them. And this is illustrated in the Congregation to Community document. There's a story of a church, I believe it was in Marion, that was trying to build a playground, and they wanted to be open to community, and they talked to some community members, and those folks said, you know, what we'd really like is a picnic pavilion so we can have birthday parties and take little gatherings on the weekend. And the church said that they had never thought about putting in such a thing when they were planning the playground, and that ended up being the most used feature on the playground, and that they were really glad that they had asked the neighbors what they might like. So that's a really great story that's illustrated in Congregation to Community. So another step would be to create or update the policies as needed. And Congregation to Community does have a model open use policy that you can look at. I will emphasize that there is no one-size-fits-all. There is no gold standard when it comes to a policy. And it's really about just putting on paper what the congregation envisions is happening. It's not, it does not have to be technical. It's really a pretty simple process of putting this policy in writing. It's important to review insurance coverage, and I'll get at that more in detail in our next slide. And then also it's important to get the word out to the community that they are welcome onto the property, let them know about whatever programming is happening or if there's open use, and also using signage to advertise the availability of the places to play and what the rules are. So liability considerations, and this is something that is covered also in the Congregations to Community document. So I don't want to overwhelm you too much with the liability considerations, but to just talk about this in a very broad way, I would say that all property owners, including faith-based organizations, that act reasonably under the circumstances to protect people from injuries are not going to be liable for injuries that occur on the property. So there's just a duty to act reasonably to protect people. And there's a special law in North Carolina called the Recreational User Statute that says that property owners that allow public access to their outdoor property for recreational use for free have an even laxer standard of care than you would normally have. So it's actually the standard of care that you would owe a trespasser. And so in that way, you would only be held liable if the injury was caused intentionally, so you intentionally injured someone, or if there was some condition on the property that showed blatant disregard for the safety of others. So not something that was merely negligent, but it has to be, a blatant disregard for the safety of others in order to be found liable. So this is a really nice statute. It gives a lot of protection to, nonprofits and folks that want to allow people on their property for recreation and not charge them. If you do charge people, then they want to hold you to a higher standard, understandably. So the important thing is that even if property owners are not going to be ultimately liable for an injury, it doesn't prevent them from being sued in the first place. And that can be costly to defend a lawsuit. And so for that reason, it's really important to work with the faith-based organization's insurance carrier to make sure that the uses of the property are covered by adequate liability insurance. And I would say that this is true whether or not the congregation engages in shared use. All faith-based organizations are inviting lots of people onto their property and members of the public. I mean, you don't know who's going to come onto the property for a wedding or a funeral or any sort of program. So you're not just expecting congregants, you're expecting a variety of people onto your property as a faith-based organization. So really, it's not that far out of line for what they're already doing. And I did talk with one insurance carrier, and he said that insurance carriers really shouldn't have a hard time with faith-based organizations inviting people onto their property because that's their business, that's what they do, and that if an insurance carrier does, then you can take your business elsewhere because somebody else might be happy to get it. So it's really not a radical idea to invite people outside your congregation onto your property for physical activity. So I just wanted to delve briefly into shared use in the school context, just to let you know that there was a new law that was passed last summer. We've long had a law allowing schools to enter into agreements with organizations to use the school property for recreation. So we're talking about contracts to use school property. And there was immunity for injuries that occurred under one of those agreements to use school property. But last summer we got an amendment that recognizes that schools can allow open use of their outdoor property for recreation. So that means that neighborhood families can just come use the playground. A school can allow that, and that there is immunity for the school for injuries that occur out of that sort of use. So I just want to let you know that we had that change in the law last summer, and that there is a toolkit on the Eat Smart Move More website, and it's a toolkit for promoting open use of school property in North Carolina. So that might be another activity that you'd be interested in working on while you're looking at shared use at faith-based organizations. And so just a final plug for the Congregation to Community document. It explains shared use terms. It gives examples of North Carolina faith-based organizations that are engaging in shared use. That's my favorite part of the document. It talks about insurance and liability. It has a checklist for working on shared use, and it offers a model open use policy. So thanks very much.
Thank you, Anna. That was a great overview of shared use practices in North Carolina, and what I want to talk about now, and this is Annie again, is actually what's happening in North Carolina. So we conducted an assessment of faith communities across North Carolina to really understand, are they opening up their facilities for the community use to support physical activity? So if they have, for example, a playground, or if they have open spaces, are they either opening those up through a formal agreement, as Anna mentioned, or are they just kind of generally opening them up as a part of their regular practice? So we carried out a survey with faith communities across the state, and this was a collaboration between NC State, the Division of Public Health, and also the Council of Churches. And we developed the survey using an existing survey that looked at public schools and looked at whether public schools were opening up their facilities for shared use. So as Anna mentioned earlier, a lot of this work on shared use has been happening in the school setting, and so we were interested to see our faith communities, like our schools, opening up their facilities for use. And I will let you all know that the questions that were developed around shared use, those are actually now a part of the Faithful Families Faith Community Assessment. So if you're at all interested in working on shared use, in addition to having that congregation to community guide, as you work with faith communities, you'll be able to talk with them using the Faith Community Assessment about their practices or policies related to shared use. So all of the questions that we developed for this survey were actually included in our new Faith Community Assessment. We distributed the survey through our Faithful Families Network. So those of you who are Faithful Families facilitators, you received the survey and were encouraged to send it out to the faith communities you've worked with. We also sent it out through, at the time, as Anna mentioned, the Division of Public Health had a CTG grant from the CDC. So the regional coordinators also sent that out to their faith community contacts. And then finally, our partners at the North Carolina Council of Churches, they are partners in Health and Wholeness Program. They sent it out to their contacts as well. And the survey asked whether existing facilities, or whether faith communities' existing facilities like those outdoor spaces, playgrounds, open spaces, or other facilities were open for outside individual or community use. And so that was the kind of first question that they answered related to shared use. And then if they answered yes, that any of their facilities were open for shared use, then we wanted to get a sense of, well, do they have a formal policy, an informal policy, which would be a kind of verbal agreement, as Anna mentioned, that's kind of those practices, or no policy at all. And if they answered no, that they didn't have any facilities that were open for outside individual or community use, then we wanted to get a sense of what were those barriers to opening up their facilities for shared use. And so the results of the survey, we actually had 386 faith communities that started the survey. 234 of those folks completed, and some of those were duplicate responses. So we had, one faith community would enter multiple times. And so we had 234 faith communities that ended up being a part of the total sample. And they were really distributed across the state and distributed in terms of size as well. So we had a nice distribution across the different regions in North Carolina, and then also a nice distribution of different sized congregations. So what was really exciting for us as we started to look at this data, and I should mention this, that we're actually, Anna and some other folks from the Division of Public Health and also from the Council of Churches and here at NC State, we're actually working on an article that we will hopefully be submitting soon that will share the results of this, but we're sharing it with you all ahead of that. But we were really excited to see that 82.9% of the faith communities who completed the survey indicated that their faith community had facilities that were open to outside groups or individuals. So as you can see, this is a really high number. So a couple of things that we could think about with this high number. One is that it's really exciting and represents an opportunity for us to continue working on promotion of shared use with faith communities, because they seem to be open to that. The second thing that we found out from this is that you might think that it was the faith communities who were participating in Faithful Families who were the ones who had the shared use policies, but that's actually not the case. So it's an opportunity for us and for those of you who are working on Faithful Families to really promote shared use and to promote these strategies among the faith communities that you're working with. Because the majority of the faith communities who had those facilities were through different networks. They were not affiliated with Faithful Families. So there are faith communities out there that we might not be working with who could really benefit from thinking about shared use as a strategy for promoting physical activity. So I want to give you a sense, as I mentioned, we had a nice kind of spread in terms of the demographics of the faith communities, a kind of even split between small, medium, and large-sized faith communities. And I'll tell you in a few minutes that the larger congregations had some differences in terms of their shared use practices. 19% of the faith communities represented were located in the most economically distressed counties in North Carolina. So we took each of the counties that the faith communities were from, and we looked at their tier ranking from the North Carolina Department of Commerce. So 19% of them were from those Tier 1 counties, 40% were from Tier 2, and 40% were from Tier 3. And then what I think you all would be really interested in is, of those faith communities that reported sharing their facilities, what facilities are they sharing most often? So if you can see here that 90% of the faith communities are reporting some sort of shared use practices with classrooms and gyms. Those were the top two. So as Anna mentioned earlier, classrooms, some of what we've seen through Faithful Families or through other work with faith communities is, if a faith community has a classroom that they might let, let's say, an outside club like a Boy Scout troop, for example, might use their facilities. But also, the way that we've seen this work with shared use is if a faith community has a classroom that they could use, let's say, on a night where people are already gathering at the faith community. Some of them have purchased TVs and DVD players to show exercise videos, or they've even invited in kind of fitness instructors to offer classes. So even though we think that some of the classroom shared use might be for just kind of general use of the space through those outside clubs or AA meetings or things like that, there are real opportunities if they're already opening up those classroom spaces to utilize those for physical activity. And then second, as we can see, second was the gym spaces, but very close behind were those playgrounds. And if you think about a lot of rural communities might lack access to to park facilities that are close to people's homes, but they might live very close to a faith community that has a playground on site. So again, this is a really great opportunity for us to think about how the faith communities that you're working with through Faithful Families, if they aren't opening up those playground spaces, or if they are and they're maybe not promoting that in the broader community, that's a really great place for children to go and to play, particularly in areas where they might lack access to those facilities. And so some of the things that we learned, our friends in the Parks, Recreation, and Tourism Management Department ran some statistical analyses of the data, and there were some characteristics of faith communities that we were looking at. So first of all, we saw that faith communities that were large were more likely to open up their spaces. And if you think about it, this makes a lot of sense. Larger faith communities, they first of all might have more spaces that could be open to the broader community, but second of all, they might have more infrastructure and more people who are able to help them to navigate or to think about those insurance questions that Anna was talking about earlier, to think about how this fits into the broader kind of policy structure of the faith community. So they might just have more resources to kind of manage and to deal with shared use. The second thing that we learned, which is similar to what some of our colleagues in Parks, Recreation, and Tourism Management here at NC State have found with schools, is that faith communities that are in counties that are more diverse are less likely to open up their spaces. And this is not a perfect measure of diversity, obviously, but it is interesting, I think, to note that both with public schools and with faith communities, that the faith communities who are in less diverse counties or communities are more likely to open up their spaces for shared use. So this is something for us to think about in extension and in public health in terms of diversity, inclusion, and ways that we're working with communities to try to bridge some of these gaps and to try to help faith communities to be settings where people can increase their access, particularly in communities that are more diverse. So for those faith communities who are not participating or who didn't have shared use practices, we did ask them about the barriers that they faced. And what I think is really interesting is that, similar to the work that they've done with public schools, is that The barriers that we expect them to report, like maintenance and liability, those were lower on the list than that they did not know where to start the process and that they haven't been asked by outside groups or individuals. So again, this is a real opportunity for us in public health and in extension to think about faith communities. They seem open to, or the faith communities that we've surveyed anyway, seem open to exploring shared use, but that no one has asked them about it before, or that they don't even know how to begin. So again, you can work with them using that congregation to community guide, using the questions on the faith community assessment to sort of see where they currently stand, and then to help to move them along to open up their facilities for physical activity. Because we know, again, in communities where they lack access to places to be active, faith communities could be a really important source of increasing physical activity for their members and also for the community at large. So, some lessons learned from this survey. One, I think the really big lesson is that faith communities are opening up their spaces for shared use. And granted, the networks we reach out to through this survey were a part of our existing public health or another health program's infrastructure. So they're faith communities who are already invested in health. However, that was a lot, a lot of faith communities across the state and I think that there's a lot of broader interest in from faith communities in general in terms of promoting health, specifically physical activity and nutrition. So it seems like a really great time to start exploring this with the faith communities we're working with. The second thing is that the barriers were not what you might typically expect. We think maintenance and liability would be the things that faith communities really are very concerned about, but they are interested and they really, their barriers were that their top two were that they hadn't been approached and they didn't know how to start. So those are things that we can help with. We can help them to know where to start, and we can reach out to those faith communities to help them get started. And so finally, there were some real opportunities to partner with faith communities around shared use to support physical activity. And we're really excited. Those of you who will be at the Faithful Family Summit in September, you're going to get an even bigger overview of these kinds of shared use practices, and also looking at how faith communities can partner with schools to promote those shared use facilities that are available in schools, or to promote active routes to school programs. So we're going to keep working on this with Faithful Families, and you're going to see a lot more of that coming up in the summit. So it's another plug for registering for the summit, which is on September 8th. And then finally, some key questions that we have, continuing on with this work is, the first one is, are people in the community aware of these shared use practices? So as Anna mentioned earlier, that's one of the steps in working with the faith community on shared use, is getting the word out there, promoting those facilities, putting up signage so that people know that the facilities are available for use. And then our second question that we want to learn a little bit more about is, are people using those facilities? So not the kind of next step down the road question, but it's something for you all to think about as you partner with faith communities, is how you might think about measuring that, of maybe going to do some checks to see if people are using the playground on the Saturday morning after they've implemented a shared use policy, for example, or after they put up signage. So it's another question that, now that we were learning more about whether they have these practices, what are people actually doing in the community? And so that really leads right into our next presenter, who is going to talk with you all about implementing some of these shared use practices in faith communities in North Carolina. And so I'll hand it over at this point to Travis Greer, who's the Worksite-Faith Coordinator for Region 8, as part of the Obesity, Diabetes, Heart Disease, and Stroke Prevention Project. And before I do that, I should have mentioned this earlier, we will have time for questions at the end, but you are welcome to enter your questions into the chat box, and we'll just get to those after Travis' presentation.
All right,
so Travis,
good afternoon, everyone. Just going to share with you a little bit about our experience thus far with shared use in Public Health Region 8. As you see there, we're in southeastern North Carolina. Assuming most of everyone on here is from North Carolina, but like I said, this regional project, kind of share with you, give you a premise behind what that is. I'm a regional person, pretty much being a partner to Faithful Families Facilitators in Public Health Region 8. So in each county, through Extension Office and health departments, there may be trained facilitators to deliver the program. They oftentimes do public health within communities of faith already, so they are recruiting and talking with faith communities already and getting church members recruited to go through the Faithful Families program, where they've done health programming or health fairs like that with that certain department from the get-go. But pretty much my role here and our role as our grant project is using Faithful Families as a vehicle to improve food and beverage standards and physical activity opportunities in communities, and promoting that linkage to other programs like diabetes prevention and hypertension management programs that we are also working on with our regional projects. So really making all things hit home with that project through Faithful Families, and making just a comprehensive approach towards health and wholeness. So pretty much putting some feet to the action based off the education through the program, and after the 9-week session, myself really coming in, partnering with the lay leader, partnering with the facilitator, and saying, hey, we had a great program. People learned a lot. They were empowered. They're taking it back with their faith community, and we've done faith community assessment. Now let's see what we can do to make some good things happen for not only the individual health, but the health of the community, the faith community, and the community at large as a whole. So moving forward there. So tools for success. I just want to give some accolades to all the partners and people pretty much who have put Faithful Families together. When I was an intern in public health years ago, I marveled at Faithful Families and kind of got my feet wet a little bit in Brunswick County Health Department, and now I'm working with it, and I'm very blessed to be doing that. But some great tools for success are there. Oftentimes in public health and all these kind of health fields, we hear of toolkits and guides and things like that. Faithful Families has really put together a good, organized, clean-cut toolkit that we can pretty much go to. We have a project we're working on, and we can go grab the tool we need to work on it. Real easy and accessible to find. So as the famous Hardison-Moody's quoted, work with what you have. So like I said, those tools are there. I just want to kind of give an illustration. Each faith community is different. Each faith community has a certain blueprint, I would say. What I mean by that is each faith community has their own demographics, makeup of community members, whether that faith community is conservative, liberal. They may have a larger worldview or community view of as their impact to their community or world at large. But also each individual of that faith community, the member, has their own strongholds or of life, whether it be, as we're talking with health, as far as their health habits. So Faithful Families is the program that can help break those bolts and those screws loose of unhealthy habits and just that maybe keeping that person down of making a change for a healthy lifestyle. Since we're talking tools, this Faithful Families program, it provides you the right tool to unscrew that screw, that stronghold in a person's life, whether it be the unhealthy lifestyle choices. If you've ever tried to loosen up a screw with maybe it's a star-shaped screw, you've seen different types of screws. If you try to use a flathead, it may not work. I would suggest that sometimes it does work, but if you use the wrong tool with the wrong maybe screw head or nail or whatever, you can kind of sometimes end up messing it up, and you may strip the screw or strip the nail, and then you really can't get it out. Any tool can't be used. So we have to be very wise and utilize all the proper measurement tools like the faith community assessment to really get the heartbeat and the feel of what's going on in that faith community and applying the right tools. And so moving forward, and that is my toolbox there. It's not very well organized like Faithful Families. So Cedar Point Disciples Church, I'm going to kind of give a real-life example. This is one of our first churches that we partnered with Sampson County Cooperative Extension. These two fine ladies here, Miss Letha Lee, she's the FNF PA with Sampson County. She is a gym, and she found a gym of a lay leader who she trained to help her facilitate this program in Cedar Point Disciples Church, which is located in Newton Grove of Sampson County. So, with that being said, this class happened in the beginning of January, went through March as far as the 9-week sessions. They met every Wednesday from 10 to 11. They had a great variety of community members, but not just members of their church, but they also had other members of different churches in the surrounding community come to attend this program there. So obvious signs there of open use and inclusiveness to communities at large and community members in that community that come do some health programs there. So their goals, as far as they established when we first met with them, as we really gauging the interest in getting started, were establishing a formal health committee, which has not been in existence, and also health promotion, offering exercise classes and health screenings. So they've already been doing some of those things. They've been a partner with Sampson County Health Department, and they've hosted a couple of health fairs at the church in times past. It's just a little bit of background. So where we are now in the timeline of Faithful Families with this church, it's not just a 9-week session. We give you education. Hope you've learned something good. Goodbye. I'll talk to you later. Pretty much where we are now is the implementation of policy environmental supports within the church. Sometimes I believe that may scare communities of faith because they hear policies and change. So where we are now with this church specifically is trying to implement and for myself be a resource and technical assistance in the church in implementing and making some of these things like shared use happen. So as far as what they have, as far as Annie's quote, work with what you have. This faith community has a formalized kind of nonprofit within itself called the Community Outreach Center. What they do is they pick children up from the school down the road, and they have like an after-school program. I believe years ago they received a grant to do that as well. So that's part of shared use, joint use with inviting school-age children, not just children whose parents go to that church, whatever. So they also, like I said, they host community health fairs on a yearly basis with the health department. They also have a trail. That was one of the things we found out when we did the faith community assessment. They had a trail. As you see in this picture, there's woods and pines back behind the church. Don't know when that picture was taken, but now currently they logged that the wooded area back there. There was about 17 acres. Since they logged it, that is their property, they are kind of looking into expanding the trail and rerouting it after the logging happened. So really making sure to see, hey, is it open to the community? There's no really formal written policy that we found out that say, hey, we allow the church or the congregation and community to use the trail. It's not really formal. It's just open use. It's kind of by word of mouth. So then they have the multi-purpose building as well. That is a building that they added on in addition, which will be to the right of the church there in a different picture. But with this multi-purpose building, they have a very nice kitchen, a meeting hall. This is more of a joint use agreement, a rental agreement like Anna Stein was talking about as well. So people of the community can rent and pay a small fee with some stipulations and guidelines. This is how we expect you to handle the building, how to use the kitchen, what we expect when you leave, and as far as cleaning and picking up. And yeah, so there's an agreement there with the community at large by, I guess, really by word of mouth that, hey, our church facility, our multipurpose building is open for use if you want to have a meeting or anything like that, or use our kitchen for a family reunion or whatever. So moving forward there, as far as a more specific example, the trail there, that's the most current. The tree's been logged. That was the initial sign they had with their small trail. It was just under half a mile of their first trail, so they're looking to make it a little bit longer. I remember one of the leaders of the church said that when the kids used to get out and walk on it before maybe church activity started, they all said, you know, it's too short. You know, we're in and out of it real quick, and so we're looking to really see how we can make that hit home and have a larger impact on the community by maybe providing some trail signage, maybe a couple benches along the way where you can sit down and maybe have a reflective thought there or two. And like I said, no real formal policy there, but really got to dig into how is this church, so to say, letting the community know that, hey, even after hours you can come use our facility. Oftentimes in rural areas of North Carolina where this church is, I'm sure there's not more than 200 cars past this church daily. It's very rural farmland, so maybe having a sign out front wouldn't be very conducive to gander support of, say, hey, come use our facility. Maybe it's by word of mouth, maybe it's through newsletter, maybe it's through mailers or whatnot, and maybe it's through establishing walking clubs. So it's kind of informal. Sometimes I feel that churches are the most formal, informal institutions at the time, but we want to do things in a formal way. We have religious ways that churches and faith communities conduct services, but kind of be informally informal, if that makes sense. So they do have a playground as well, and like I said, there's no formal written policy there. All very much informal. And finishing up there, this is a picture that was taken was one of the cooking demonstrations during the Faith Families class. Miss Lisa Lee, she's doing a healthy baked chicken recipe using cornflakes to coat it instead of fried chicken. So pretty much this church has expressed interest in offering more cooking and preparation classes and preservation classes. So there's another opportunity to extend an arm or a hand out to the community and welcome them to learn more how to cook smart and eat smart as well. So that's their nice kitchen facility that is available to use as part of their multi-purpose facility there. So that's one thing I see. I've seen a lot of informal agreements and uses within shared use within the faith community. So I'm going to turn that back over to Annie, and we'll get some questions going.
Thank you so much, Travis. I think I hope that you all appreciated getting to hear kind of a local picture of what some shared use practices might look like and how to promote those. And I love the ending with that example, even though this is about physical activity, that another part of the faith community assessment is figuring out if they have kitchen space and if they have a kitchen committee and thinking through that, because that's another opportunity for community members to come into the faith community setting or to use those resources they might have. So one last thing before we take questions is I want to show you all some of these resources on the Faithful Families website. So our website is just faithfulfamiliesesmn.org if you haven't visited there before. And as you can see on the resources page, if you click on the resources page, that's the link to the faith community assessment that we've been talking about. There are also links to physical activity policies and all sorts of resources for thinking about helping faith communities to change their environment to support physical activity, and including those shared use tools that Anna was talking about earlier. So if you click on the shared use by North Carolina faith-based organizations link, that will take you to that Congregations to Community guide. So I wanted to be sure that you all saw this on the Faithful Families website, as well as the other tools that are here, including all the handouts, videos, and other guides and resources. And then a last plug, if we go back to the website, you can find out more and register for the Faithful Families Summit, which is on September 8th on our website. So I really encourage you to check that out. And as you'll see, we have a session that is focusing on encouraging shared use for physical activity. And that will be led by Jason Beccaro, who's from the Department of Parks, Recreation, and Tourism Management at NC State, but also will feature Lori Rue from the Division of Public Health and one of the Active Routes to School coordinators who will talk about connecting faith communities with Active Routes to School programs. So at this point, we have about 10 minutes left. We'd like to open it up for any questions, and you're welcome to type those into the chat box, or you can use your microphone to ask us those questions.
Hey, this is Travis. I know I just got done talking, but it just, the light bulb went off on my mind. I believe when Anna was mentioning about the school-based joint use agreements, shared use, and connecting faith and schools to partner together to bring together more physical activity opportunities. I recall, and this is one thing that I've suggested as an opportunity, is connecting the faith and physical activity part of it is, if you have walking clubs within your church, we can help you mark out a walking trail and a path within the parking lot, just a measured distance, a measured amount where you can walk. But having so-called prayer walks, someone leading, facilitating that, and that's a combination of maybe getting the health committee together and a prayer team or a prayer committee and saying, we're going to have a prayer walk within our community, if our community is walkable, or we'll just do it on the church grounds, that we will have certain stops. I remember at my community of faith years ago, we had a prayer walk on our campus when we were building our new facilities, and, church grounds are pretty big, and we had certain stopping points where we would pray that this was, say this is going to be the future of the potential school or the new worship center or whatever, or the new playground, and we would say a specific, prayer at that stopping point. Then we would walk to the next point. But another thought I've thought about too is, and I've heard an example of before, is a partnership between schools and churches that they would allow before school begins, since we're thinking back to school here soon, that they would allow communities of faith come on the school campus and do prayer walks as well. They not necessarily would let them inside the school halls, but they would walk around on the campus and do a similar situation where they would do prayer walks, of course, to get physical activity, but they're also doing the spiritual aspect that the communities of faith are also well known as. So just tossing that out there.
Thank you for sharing those, Travis. And Laura Lee Jones would like to talk, and I have a feeling she's going to build off what you just said.
Hi, Annie. My hand was raised when you asked us to raise hands earlier, so no, I wasn't trying to interject.
Okay, well, I'm going to talk about an example, since we don't have any questions right now, that Laura Lee and I, Laura Lee Jones is our state SNEP coordinator, the Expanded Food and Nutrition Education Program, and she and I have been working on a project with 3 other states who have been implementing Faithful Families, Arkansas, Tennessee, and Florida. And we were just in Tennessee last week, and we heard an example similar to what Travis is talking about of a church that wants to map out a route in the neighborhood, in the church's neighborhood, where there are 3 other churches close by, and they're going to invite all of the pastors of those churches to do walking sermons on a regular basis. So similar to what Travis was talking about of having like prayer meditation walks, or having, kind of these, those things of having walking, similar to what we do in Worksite Wellness, encouraging walking meetings, having walking worship. So I thought that might be what Laura Lee was going to talk about, so I'll just talk about it instead. And then one other fun example that if you all haven't seen, there's a video on our website of Mount Peace Baptist Church, which is in Southeast Raleigh, and they actually have marked out their parking lot, as Travis mentioned, as one of those strategies, and they have every 3rd Sunday workout. It's called Workout Worship, and people come to worship dressed down and they have active movement during the worship service. So they have kind of upbeat songs and people are moving during the service. And then after all 3 of their services, they go outside and walk around the parking lot. And I think it's 6 times around the parking lot is a mile. So they've mapped that out. So again, that's another way of what Travis said, that I said, kind of using what you have. That didn't cost them anything, but it's a way that they're really improving physical activity for their faith community, but also for others who want to participate in that. Does anyone else have any questions or thoughts? All right, well, I think that we will wrap this up. Just as a reminder, all of our webinars are recorded, and we will put them up on our website. For those of you who are at NC State, you can access the recording via logging into our Collaborate website, but we will download the actual MP4 and the video, and we'll put that on the Faithful Families website on our blog. So be sure to check that out. It takes a few weeks for the video to load from our NC State IT folks. So in about a month, this recording will be on the Faithful Families website. Don't forget about registering for the Faithful Families Summit, and don't forget to be in touch with Kamaria and to welcome her to the team. We're really excited to have her, and I know you all will really enjoy working with her. I already have, and she's only been with us for how many days now? 10 days. So thank you all for coming, and we look forward to seeing you in November for our next webinar.